Welcome to Big Feelings Lab, where we dive into what really goes on behind mental health labels. Let's jump right into it, looking at conditions like ADHD, autism, bipolar disorder, BPD, and the rest.
I'm excited to get into this. There's so much nuance here, right?
Absolutely. Take ADHD, for example. It's not simply about being unfocused, it's like
Mm,
your brain's executive system, the CEO, if you will, operating a bit differently. People often misinterpret the symptoms as laziness, but it's really all about interest based attention.
yeah, so it's less about trying and more about how the brain responds to stimulation, right?
Exactly. And then there's autism, which is totally misunderstood. It's not just one way of being, it's a spectrum. Think of it as a collage of traits, where some folks might excel in pattern recognition, while others experience intense sensory overload in daily settings. It really opens your eyes,
Yeah,
doesn't it?
it really does. And what about bipolar disorder? People keep reducing it to mere mood swings.
Spot on. Bipolar disorder isn't just sudden mood changes. It involves prolonged episodes of mania where someone might feel invincible and then sink into deep depression with hopelessness. It's a serious shift that lasts
Right.
weeks or even months, not just fleeting moments.
I mean, the contrast between those states can be downright harrowing.
And speaking of intensity, borderline personality disorder, or BPD, is often painted as just drama, but it's really about overwhelming emotional responses. Imagine your emotional dial is stuck at 10, making even minor conflicts feel catastrophic. Plus, that
Mm,
deep fear of abandonment totally amplifies things.
I get that, but isn't it a bit simplistic to say it's all just an emotional dial? What about the underlying pain that really drives those behaviors?
Good point. It's not just the intensity, it's the push pull dynamic in relationships, a protective yet misdirected reaction to deep seated fears.
Moving on, OCD really fits into this too. It's not about being overly tidy, but about intrusive thoughts and compulsions that try to reestablish control.
Yeah, it's like your mind gets locked in a loop, and those rituals, checking, counting, or repeating phrases, are desperate attempts to ease that anxiety.
Yeah.
Exactly right.
And then with PTSD, those triggers can turn everyday moments into a battlefield for the mind.
Exactly. Flashbacks, distraction, and hypervigilance. It's a state where the brain remains in constant survival mode, and
Mm.
that spills over into every aspect of daily life.
Then there's the whole conversation about eating disorders and the harmful stereotypes that come with them, plus substance use, which, based on trauma, really speaks to how much our experiences shape our health.
Absolutely, mental health conditions are medical, not character flaws. Medication, therapy, even things like CBT or DBT offer real pathways to feeling more like
Right.
yourself, and finding the right support system is crucial.
It truly comes down to education and compassion. We need to challenge those stereotypes and ensure everyone has access to help.
Exactly. Understanding these conditions honestly paves the way for a supportive, stigma free world where everyone can thrive.
Agreed. If this conversation resonates with you, remember mental health is just health. Take care of yourself and each other.